Questions 1. Mallampati score is used during in the A. ET tube insertion, B. Chest tube insertion, C. ET tube removal, D. Chest tube removal. Right answer is A. ET tube insertion. Questions 2. The physician has inserted a chest tube in a client with a pneumothorax. The nurse should evaluate the effectiveness of the chest tube. A. For administration of oxygen, B. To promote formation of lung scar tissue, C. To insert antibiotics into the pleural space, D. To remove air and fluid. Right answer is D. To remove air and fluid. Questions 3. The purpose of chest tube drainage is except A. To prevent pneumothorax, B. To prevent empyema, C. To treat hemothorax, D. To treat emphysema. Right answer is D. To treat emphysema. Questions 4. The most common ET tube used for 6 years old children is A. 5 mm, B. 6 mm, C. 4.5 mm, D. 6.5 mm. Right answer is A. 5 mm. Questions 5. 2 days after placement of a pleural chest tube, the tube is accidentally pulled out of the chest wall. The nurse should first A. Immerse the tube in sterile water, B. Apply an occlusive dressing such as petroleum jelly gauze, C. Instruct the client to cough to expand the lungs, D. Auscultate the lungs to determine whether they collapsed. Right answer is B. Apply an occlusive dressing such as petroleum jelly gauze. Questions 6. During the first 36 hours after the insertion of chest tubes, when assessing the function of a 3-chamber closed chest drainage system, the nurse identifies that the water in the underwater seal tube is not fluctuating. What initial action should the nurse take? A. Take the client's vital signs, B. Inform the healthcare provider, C. Turn the client to the unaffected side, D. Check the tube to ensure that it is not kinked. Right answer is D. Check the tube to ensure that it is not kinked. Questions 7. Which nursing action is important when suctioning the secretions of a client with a tracheostomy? A. Use a new sterile catheter with each insertion. B. Initiate suction as the catheter is being withdrawn. C. Insert the catheter until the cough reflex is stimulated. D. Remove the inner cannula before inserting the suction catheter. Right answer is B. Initiate suction as the catheter is being withdrawn. Questions 8. Why should the child be subjected to chest tube after surgery? What should the nurse consider before responding in language the parents will understand? A. They will increase tidal volumes. B. Drainage of air and fluid will be facilitated. C. Positive intrapleural pressure will be maintained. D. Pressure on the pericardium and chest wall will be regulated. Right answer is B. Drainage of air and fluid will be facilitated. Questions 9. A removal of the left lower lobe of the lung is performed on a client with lung cancer. Which measure would usually be post-operatively included in the plan? A. Closed chest drainage, B. Tracheostomy, C. A mediastinal TATE, D. Percussion, vibration and drainage. Right answer is A. Closed chest drainage. Questions 10. The doctor is preparing to remove chest tubes from the client's left chest. In preparation for the removal, the nurse should instruct the client to A. Breathe normally, B. Hold his breath and bear down, C. Take a deep breath, D. Sneeze on command. Right answer is B. Hold his breath and bear down. Subscribe my channel and join Telegram for PDF. Telegram link in description. Questions 11. Immediately following the removal of a chest tube, the nurse would A. Order a chest X-ray, B. Take the blood pressure, C. Cover the insertion site with a Vaseline gauze, D. Ask the client to perform the Valsalva maneuver. Right answer is C. Cover the insertion site with a Vaseline gauze. Questions 12. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 ml. The nurse should give priority to A. Turning the client to the left side, B. Milking the tube to ensure patency, C. Slowing the intravenous infusion, D. Notifying the physician. Right answer is D. Notifying the physician. Questions 13. A pneumonectomy is performed on a client with lung cancer. Which of the following would not be an expected prescription? A. Closed chest drainage. B. Pain control measures. C. Supplemental oxygen. D. Cuffing and deep breathing exercises. Right answer is D. Cuffing and deep breathing exercises. Questions 14. The physician is about to remove chest tubes from the client. Which client instruction is appropriate? A. Take a deep breath, exhale and bear down. B. Hold the breath for 2 minutes and exhale slowly. C. Exhale upon actual removal of the tube. D. Continually breathe in and out during removal. Right answer is B. Hold the breath for 2 minutes and exhale slowly. Questions 15. Which of the following ET tube used in 5.5 years old children? A. Cuffed 5 mm. B. Non-cuffed 5 mm. C. Curved 5 mm. D. Non-curved 5 mm. Right answer is B. Non-cuffed 5 mm. Questions 16. Why would cricoid pressure be applied during the intubation procedure? A. To help prevent the patient from moving inadvertently. B. To help visualize the adenoids. C. To help prevent aspiration of gastric contents. D. To help open the patient's airway. Right answer is C. To help prevent aspiration of gastric contents. Questions 17. Which of the following ET tube used to prevent nosocomial infection? A. Cuffed endotracheal tube. B. Non-cuffed endotracheal tube. C. CASS ET tube. D. Straight endotracheal tube. Right answer is C. CASS ET tube. Questions 18. Which of the following position provided during tracheostomy? A. Rose. B. Sniffing the tube. C. Ramped. D. Semi-Fowler. Right answer is A. Rose. Questions 19. Which of the following position provided after tracheostomy? A. Rose. B. Semi-Fowler. C. High Fowler. D. Sideline. Right answer is B. Semi-Fowler. Questions 20. What is the main purpose of the tube man balloon tracheal cuff? A. To measure the tube size. B. To hold the tube in position. C. To prevent infection. D. To prevent air leakage. Right answer is D. To prevent air leakage. Questions 21. What is the main purpose of the pilot balloon? A. To prevent air leakage. B. To maintain breathing. C. To help in suctioning. D. To assess the main balloon. Right answer is D. To assess the main balloon. Questions 22. What type of tracheostomy must the head of bed be elevated at all times? A. Plastic TT. B. Cuff TT. C. Uncuffed TT. D. Metal. Right answer is C. Uncuffed TT. Questions 23. Which of the following instruments must be kept at bedside for tracheostomy patients? A. Suction catheter and ambu bag. B. Replacement tube and obturator. C. Ambu bag and obturator. D. Scissors and ambu bag. Right answer is B. Replacement tube and obturator. Questions 24. What type of tracheostomy has an increased risk for aspiration compounded by G-tube feedings? A. Plastic tracheostomy tube. B. Cuffed tracheostomy tube. C. Uncuffed tracheostomy tube. D. Metal tracheostomy tube. Right answer is C. Uncuffed tracheostomy tube. Questions 25. What is the main purpose of the fenestration tracheostomy tube? A. To improve oxygenation. B. To prevent infection. C. To help in phonation. D. To provide humidification. Right answer is C. To help in phonation.